preventative treatment of older persons to help increase their longevity and quality of life. The field also includes late-stage care for patients near death as well as therapy for grieving loved ones. Social gerontology. Social gerontology is seen as a science-based but application-oriented subdiscipline of gerontology. It focuses particularly on social relationships in old age, social participation of elderly and old people, and the protection of their individual needs. Social theories of aging. Activity theory was developed and elaborated by Cavan, Havighurst, and Albrecht. According to this theory, older adults' self-concept depends on social interactions in order for older adults to maintain morale in old age. Substitutions must be made for lost roles. Examples of lost roles include retirement from a job or loss of a spouse. Disengagement theory was developed by Cumming and Henry. According to this theory, older adults and society engage in a mutual separation from each other. An example of mutual separation is retirement from the workforce. A key assumption of this theory is that older adults lose ego energy and become increasingly self-absorbed. Additionally, disengagement leads to higher morale maintenance than if other adults try to maintain social involvement. This theory is heavily criticized for having an escape clause, namely, that older adults who remain engaged in society are unsuccessful adjusters to old age. Age stratification theory. According to this theory, older adults born during different time periods form cohorts that define age strata. There are two differences among strata: chronological age and historical experience. This theory makes two arguments. Age is a mechanism for regulating behavior and as a result determines access to positions of power. Birth cohorts play an influential role in the process of social change. Life course theory. According to this theory, which stems from the life course perspective, Bankston and Allen, 1993, aging occurs from birth to death. Aging involves social, psychological, and biological processes. Additionally, aging experiences are shaped by cohort and period effects.
Nadala mo na ba lahat ng kailangan? Towel, toothbrush, pero ito...
Cumulative advantage-disadvantage theory. According to this theory, which was developed beginning in the 1960s by Derek Price and Robert Merton, and elaborated on by several researchers such as Dale Danifer, inequalities have a tendency to become more pronounced throughout the aging process. Advantages and disadvantages in early life stages have a profound effect throughout the lifespan. However, advantages and disadvantages in middle adulthood have a direct influence on economic and health status in later life. Gerontological social work. Gerontological social work focuses on maintaining and enhancing the quality of life of older adults and their families. Social workers try to alleviate barriers that may prevent or inhibit the elderly from receiving assistance. As much as possible, social workers also try to help the aging maintain a sense of dignity and independence as they get older. This may involve engaging in academic research on how to best help elderly adults cope with the aging process, assisting clients with concrete services such as benefits and food, or providing psychological counseling. The field of gerontology recognizes that older adults have distinct characteristics that can be differentiated from earlier stages of adulthood. Social work practice with older adults encompasses a broad range of functions. Whether working in micro or macro settings, the primary goal of the social worker is to address the specific challenges of the aging process by promoting independence, autonomy, and dignity in later life. Social workers in gerontology must be knowledgeable about unique legislation, policies, and social programs that affect older adults. In addition, they must be knowledgeable about the aging process and the issues older adults and their caregivers face, adept at accessing resources for clients, and strong advocates who champion their rights. Importance of gerontological social work. Globally, older adults remain among the most vulnerable to marginalization, poor health, poverty, and income insecurity. At the macro level, social work professionals play an important role in policy development. At the individual level, they provide mental health counseling and can assist older adults experiencing changes in health and functional status and their families identify resources, services, and benefits. While changes resulting from loss, disease, and disability have been the predominant focus in gerontological social work, we cannot neglect the potential and ability found in older adulthood. Many older adults continue to live active and productive lives, contributing to society and their families in myriad ways. Remaining true to social work values in which older adults are treated as agents rather than problems. Social work professionals who understand aging recognize and promote the capability of older persons to remain productive and less dependent in later life. Gerontological social worker. Gerontological social workers are experts at meeting the biophysical needs of older adults. Part of the job is connecting the elderly with community resources. Social workers coordinate care for individuals who need a number of services and who will, over a period of months, years, and sometimes decades, require care at different levels. They help elderly individuals and their families examine their needs and determine how they will be paid for. They assist them in applying for needed services and dealing with problems as they arise. They may help seniors fill out various other kinds of paperwork, including advance directives. Gerontological social workers may need to assess clients' functional capacity. They have some expertise in recognizing the difference between normal and abnormal aging processes and will refer clients to medical professionals when necessary. Geriatric social worker. Geriatric social workers often serve as discharge planners, making sure that community-based services will be in place when seniors step down from hospitalization to less intensive care. Clinical social workers offer therapy to elderly adults who are experiencing depression or anxiety. Gerontology social work settings. Work settings are varied and can include referral centers, rehabilitation centers, long-term care, outpatient health services, adult protection services, governmental agencies, faith-based agencies, private practice. Social workers are employed by area centers on aging, providing direct services and advocacy. Gerontology